Hi, good morning. My name is Dalva. Today I'm gonna perform insertion of Foley catheter. This is my school ID. This is my uniform, but it's not the school uniform because I didn't receive it yet. This is my equipment. This is my patient. This is my hand sanitizer. This is my garbage bag. First, I'm gonna knock on the door to introduce myself to my patient. Knock, 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 knock. I'm gonna close the curtain behind me and then give my patient privacy. Hi, good morning. My name is Dalva. I'm gonna be your nurse today. Please, can I have your first and last name and your date of birth? Okay, can I check your waistband? Okay, today I'm gonna perform insertion catheter Foley. Is that okay with you? Okay, thank you. First, I'm gonna wash my hand. I'll be right back. I use hand sanitizer to wash my hand. I'm gonna apply a clean glove. Hi, Mrs. Smith. Today the doctor has ordered the placement of a Foley catheter. This is a tube. Is going to sit in your bladder to drain urine out. Is that okay with you if I place it for you today? Okay, I have my patient consent. First, I'm gonna clean the area. I'm gonna take my wash clothes with no rinse soap and water. I'm gonna bump the head of my patient up to walk in as a high position. First, I'm gonna clean the area from the top to the bottom, anterior and posterior. I'm gonna fold it. I'm gonna clean the middle part now. Put in the garbage. Now I'm gonna dry. I'm gonna do same thing from the top to the bottom, anterior and posterior. I'm gonna fold it again. Do the middle part. Okay, Mrs. Smith. Now I'm gonna check your anatomy. I'm gonna check your meatus. I see your meatus is open. Now I'm gonna check if there is any discoloration, any discharge, odor, smell. Okay, Mrs. Smith. Now I'm going to take off my gloves. Turn it inside out. Turn it inside out. Put it in the trash. I'm gonna sanitize my hand. Now, Mrs. Smith, I'm going to the sterility part. I'm going to insert the catheter for you. Is that okay with you? Okay, Mrs. Smith. Now I'm going to open my sterile kit. I'm gonna sanitize my hand again. I'm gonna open it from 1 inch margin. I'm gonna make sure do not touch it inside. Now I'm gonna take my gloves out. I'm gonna use 2 fingers. I'm gonna open my gloves. I'm gonna make sure do not touch it inside. I'm gonna use 2 fingers. I'm gonna use 4 fingers. I'm gonna make sure it doesn't touch at the exposed part of the other gloves. It doesn't roll up my wrist. Now I'm gonna pull my thread out. I'm gonna open it with my hand. I'm gonna move a little bit here. I'm gonna put my treat with my clean hand, my sterile hand. I'm gonna make sure to move it a little bit from here. Touch inside. I'm gonna put it in on the bottom. Mrs. Smith, can you lift your heat up for me? Okay, thank you. I'm gonna take the other tray. Okay, Mrs. Smith. Now I'm gonna pull up my alcohol pad. I'm gonna open it. I'm gonna open my lubricant. Now, Mrs. Smith, I'm gonna clean the area for you. You can feel my hand touching you, okay? I'm gonna clean from the top to the bottom, and then in the middle area, from interior to posterior. Mrs. Smith, you're gonna feel my hand touching you, okay? I'm gonna clean the other part now. I'm gonna clean the middle part now. Okay, Mrs. Smith. Now, I'm gonna set up my catheter. I'm gonna make sure to take off the plastic bag. Now I'm gonna attach the syringe. I'm gonna make sure it's 10 cc of fluid, 2 to 3 inches. And then, Mrs. Smith, I'm gonna insert the catheter now. Mrs. Smith, I'm gonna touch on you now. You're gonna feel my hand touching you. It's a little bit cold, okay? I'm gonna insert the catheter like 2 to 3 inches. I'm gonna advance. Can you take a deep breath for me, please? I'm gonna advance to 2 inches. Okay? Please let me know if you feel any discomfort, Mrs. Smith. I'm gonna make sure to secure the tube. Now I'm gonna put my 10 cc fluid. Okay, Mrs. Smith. Please let me know if you feel any discomfort, if you feel any pain. Okay, Mrs. Smith, I inject my 10 cc of fluid. I'm gonna make sure the tube is secure. Okay, Mrs. Smith, you almost done. Okay, Mrs. Smith, now I'm gonna remove the tube. I'm gonna put it in the trash. Okay, Mrs. Smith, now I'm gonna clean you up now. Okay, Mrs. Smith, now I'm gonna hang the bag on Mrs. Smith's bed, on the lower position of the bed. Okay, Mrs. Smith, now I'm gonna clean everything, okay? I put everything in the garbage. Make sure do not touch it. Now I'm gonna remove my glove, turn it inside out. Use my 2 fingers, turn it inside out. Now I'm gonna use hand sanitizer to wash my hand. Mrs. Smith, I'm gonna make sure my patient is positioned comfortable. Mrs. Smith, if you feel any pain, please let me know. I'm gonna come back to check on your drainage. If you have any questions, please let me know. Now I'm gonna document my result. I'm gonna close the curtain, give my patient privacy, and leave. Thank you.